Delhi is gearing up to roll out the COVID-19 vaccination drive. About 1,000 vaccination booths will be set up across Delhi, and up to 1 lakh people could be vaccinated daily. Now, the Delhi Chief Minister Arvind Kejriwal also recently announced that 51 lakh people of 3 priority groups will receive the vaccination in the first phase. About 1,000 vaccination booths across will take place in the first phase, and up to, like I said, 1 lakh people to be vaccinated. Each vaccination booth will have about 100 people there, and there will be several tiers of security that will take place. But it's not just Delhi that is gearing up. There is a dry run on in the country as we speak in 4 specific states. How will we prepare an end-to-end understanding of what the protocol will be like and what are the hiccups, perhaps, and bottlenecks at the moment to identify that? The dry run of the COVID vaccination drive is taking place in states like Andhra Pradesh, in Punjab, in Gujarat and Assam. Now, the focus of this management is possibly towards the adverse events after immunization as well. The dry run will include checks on cold storage, on transportation arrangements, and all of them have been made part of the program as well to ensure that it is done all smoothly. Now, to talk to us about these dry runs, we have Dr. Anish Sinha joining us. Thank you so much for speaking with NDTV, Doctor. Now, these dry runs are very interesting because the government said that it will be like rolling or holding elections in the country. Take us through at this point, what are the key concerns and areas that we need to look at?
Yeah, right from the last 2 to 3 months when it was declared that we are very close to having a vaccine, so the entire world started preparing for its rollout. Accordingly, India also started to think for it, to plan for it, and there was a think tank on this. The National Expert Group was created for vaccine administration for COVID-19, and the challenges which were anticipated, like the cold chain, the transport of vaccines, the digital platform which was required for tracking the beneficiaries, the possible adverse events. So all those government have tried to address through various efforts like training, development of modules, augmenting the cold chain infrastructure, developing a IT platform called CoWIN. Now a time has come to test this in the field, what we call it as a dry run or an end-to-end dry run, so that if there are any gaps which are still there can be rectified, and this is being done in 4 states with 2 districts in each state, and like for Gujarat, it's Gandhinagar and Rajkot, which is taking this dry run. So what they are actually looking for, they're basically trying to identify whether the systems in place will be able to identify and respond to a possible adverse event that may occur, the cold chain, the transportation, the crowd management. So how they are going to handle it. So that will be assessed. Then end-to-end mobilization and testing of the COVID vaccine process entirely, that the CoWIN platform, whether it's a very robust platform, but its testing in the field has not been done. So that will be tested very rigorously. And the third important, because it's going to be a COVID era, as we all know, so the infection prevention and control measures that has to be put in place at the session sites. So even at the booths, so that is important. So there are standard protocols and guidelines have been issued for that also, and trainings were given. So whether that is being followed or not, so they will be doing this.
Right.
To run this
Dr.
is a
Sinha, if I can interrupt you over there and ask you, do we have in the country enough medical professionals to carry out a drive like this?
Yeah, so we shouldn't forget that our country runs the world's largest universal immunization program, immunizing 2.7 crore infants and almost 3 crore pregnant women on a yearly basis, and with multiple vaccines to the infants. Then we have successfully conducted pulse polio campaigns immunizing over 20 crore children in a short span of time. We conducted measles rubella campaign also, covering almost 20-25% of the entire population. So to me, we have these advantages, of course, because this is a much bigger drive than the names that I mentioned.
Right.
So some augmentation and better planning needed. So I think with the existing mechanism and the capacity that has been strengthened in last 2-3 months, we will be able to sail through in a reasonably good manner.
All right, so we're all prepared for the vaccine. That's the takeaway that I'm taking from this. Dr. Sinha, thank you so much for joining us. But stay on. We have a couple of questions lined up for you as well. But first up, let's give our viewers a quick rundown on how India has done in the past 24 hours when it comes to COVID figures. Well, at the moment, about 20,000 fresh cases have come in. They're nearly 9% up than the previous day and taking the total tally at the moment to over 1 crore at this time. Also, over 1,47,000 deaths have been reported. These are lives lost to the virus.